Hello everybody, this is Dr. Jung Ho Cha. Today we'll be talking about anti-aging procedures. Basic concept of anti-aging surgery is lifting the sagging portion, smoothing out the surface, and increasing the volume of the frontal portion as well. Now, lifting the sagging portion is not only involves to the facial areas, but also in the eye areas as well. So a lot of people, there's the skin sags, the skin of the lower eyelid sags, we have the eye bags protruding, and also it's not just the protruding of the eye bags, but then the malar fat tissues, they go away as well. If you look at babies, if you look at kids, their cheeks are pretty plump, but then as aging goes away, it gets a little bit flat because the malar fat tissues, they get atrophic, they go away. In order to reverse that, we want to add a little bit of the volume here using your own fat tissues. So it's not too much, but just to add a little bit of the fat tissues and smooth out the surface at the same time. And for the lower eyelids, you want to reduce the size of the eye bags and then fill in the direct hollowness directly underneath the eye bags using your own fat tissues, or repositioning your fat tissues and tightening the lower eyelids. Now this process is called fat graft in the facial areas and lower eyelid surgeries, lower blepharoplasty. And then for the upper eyelids, when it's sagging, it usually sags much more on the outer corner compared to the inside. So we will just want to move back in time. So we want to remove the excess skin that's sagging and do whatever's necessary inside the eyelid skin area. And then for the facial areas, we want to lift, especially the side areas, the jowl lines, the smile lines are deepened because the soft tissues are sagging to the frontal lower direction. So when we want to move back in time, we just want to lift this oblique wise upwards so that it just retains its shape moving back 10-15 years. Now, there are many types of lifting procedures, so probably the most effective procedure would be the full facelift. But I just like to call it a SMAS lift because we lift the SMAS portion, lift the SMAS layer from the deep plane as much as possible, release some of the retaining ligaments, which try to pull back to where it was before. So by releasing those, part of those ligaments, it has this frees the soft tissues and then they can lift upwards much more. And then for the superficial layers, we want to redistribute it along the line. When the facial tissue is sagging, it usually accumulates along the lower border. So it's not just the jowls that's forming, but then the side areas, we see that it's not very even. You have lumps here and there. We want to redistribute all of that along the line so that we have a smoother surface. That can be achieved through the facelift procedures. Now, a little bit of the neck lift can be done through the facelift procedures because we are going to pull from behind the ears as well. But then for people with a little bit more excess sagging, then we may need a separate procedure called neck lift, the platysmoplasty. There are two muscles starting from the jawbone all the way towards the sternum and clavicle here, and those two muscles begin to separate apart from each other and starts to sag. So we just want to move back in time by placating these two muscles like a corset on the inside, and then tighten the muscles and skin all at the same time. Now, people who are afraid of full facelift, then in that case, I can consider doing a thread lift. Now, there are two different types of threads that I usually talk to patients about. There are some of the very small threads where we can put multiple threads along the facial areas. And a lot of people can't remember, so I ask them, how many threads did you use? And they probably say about like 10, 15 threads on each side. And that's probably the small threads that's inserted here. Now, those threads, I really am not sure about the effect itself. I think it's more closer to placebo. We want something actually that works much more. So we have thicker threads that's inserted from here on the end, here in the hairlines. So we wouldn't need an incision, just a needle poking where for the entry point of the threads goes in. It specifically targets this area here and grabs the soft tissues and brings up. Now, if you look at the threads, it's an absorbable thread, so it has spikes along the thread line. It grabs the soft tissues on the inside and pulls. And as wounds heal and the threads they degrade, there's going to be collagen formation along the inserted site, which refrains the soft tissues from immediately going back to what it was